Welcome to EuroPCR and welcome to the PCR Alvimedica session. My name is Stefan Verheye from Antwerp, Cardiovascular Center in Antwerp, Belgium. And I have the pleasure to be joined today with the Alvimedica session with Professor Colombo from Italy and Professor Sardella from Italy as well. Welcome, gentlemen.
Thank you.
So today we are going to discuss the Cre8 stent, the Cre8, which is a unique polymer-free drug-eluting stent that has a unique amphilomous formulation with an abluminal release of the drug, the substance, that is seen to be very associated with good results in diabetic population. Diabetes is a huge problem these days with almost 390 million prevalence of diabetes, and it is expected to increase with another 200 million people with diabetes in 20 years from now. So it's a serious problem. So therefore now I would like to ask a question to Dr. Colombo. You have a huge experience in testing many drug-eluting stents in several populations, and a lot of them have failed in a diabetic population. So in your opinion, what are the required expectations for a drug-eluting stent in such a challenging population?
But it's not easy for a new stent to deliver good result in diabetics. As you said, in the last 10 years, almost all drug-eluting stents, even the second and the third generation, have failed, and nobody is really doing a dedicated trial in diabetics because they know that such a device does not exist or may not exist, because maybe it will exist. The most well-conducted study is a freedom study where we have 5 years follow-up, and in that study at 2 years we have over 12% target lesion revascularization, over 6% mortality. So it's not single digit, it's a double digit and even more, and was a relatively selected population in the freedom. So the problem is definitely there, and we need a device able, I would say, to solve, but to ameliorate this problem.
And what are the items or the features that could contribute to that for such a specific device?
I don't want to go into some hypotheses, but we need some device able to deliver the drug inside the diabetic cell. And we know that is not just increasing the dosage of the drug, because you may remember CIPHER study was done in double dose, the so-called 2D, double dose in diabetics, and even doubling the dose was not effective. So the problem is to get the drug in the cell.
I understand, yeah. Dr. Sardella, you have shown wonderful results in your presentation on the Cre8 and diabetic. Congratulations with those beautiful results. And it looks like this is almost independent from the type of diabetes. So how can you explain that this device is doing so well, whereas other ones have actually failed?
This is central. I think that in the Cre8 that was presented from Alvimedica, there are 3 distinctive features. That is the very innovative device, because it has an abluminal reservoir technology, the amphilomous formulation, and the bioinducer surface. But the really innovative section is the amphilomous formulation, that is sirolimus plus fatty acids that make a combined effect on the diabetic cells. Because we know that the diabetic cells is a modified cells, and it needs an overexpression on the membrane protein that allows the fatty acids to intake the sirolimus. And for this reason, I think that the real good results about the studies, it was the participant study, with the study primary endpoint was the MACE, 6 months, and with diabetics and overall population, and they showed a great result in terms of TLR. And moreover, Romaguera last year in PCR, he presented a reservoir study. The reservoir is a randomized study, Cre8 versus X-Science family, and they showed a late lumen loss in diabetic patients of just 0.14, and we know that the late lumen loss in the real Achilles wheel of the diabetic patients versus 0.24, but what is important is the standard deviation, that it was very tight in the Cre8, that it was 0.24, and it's very large, it's 0.57 in the other group. And in our study that you mentioned before, the Investigate, we observed the same results in diabetic and non-diabetic. Thus, in our study, Cre8 shorten the difference in terms of outcome between these two very different groups of patients.
Yeah, that's wonderful. Dr. Colombo, based on these results and knowing that diabetes is an extremely challenging population, would you be satisfied with this number of results and trials that have been done so far? And is that convincing enough to take it into daily practice? Or would you recommend to see more vast amount of data to convince to the community? And if so, what would you recommend to take place for other people to convince?
But these results gave us the support to do what I call the ultimate study, the Cre8 diabetes study, to prove in an evidence-based fashion that this device is not non-inferior but is superior to current best drug-eluting stent. And here is a diabetes with Cre8. It's a very nice combination. Randomized study, over 2,000 patients, randomized 1-to-1, Cre8 versus everolimus-eluting stent with target lesion failure at 1 year as the primary endpoint, with the idea to demonstrate superiority. And I'm very pleased because as important as it can be a study of non-inferiority, we need to start entering the field of superiority. And Alvimedica and CID should be congratulated for taking this risky step, because every time you put yourself into a study of superiority is risky. But the preliminary data acquired in the last few years are very encouraging. So I think it's a risk worth taking.
That is wonderful. So as a conclusion, thank you very much, gentlemen, for this interview. This was a wonderful contribution. And to wrap up, I just want to thank Dr. Colombo and Dr. Sardella for this interview. We know that diabetes is a difficult population to handle and to tackle and to treat, but it looks like, based on what we have seen from the Cre8 data, that we have a specific dedicated stent to target this population, and we are very much looking forward to the new trial that is being announced, where we have hopefully will get the results next year. Thank you very much. Thank you, gentlemen.
Thank you.